Hi guys, my name's Steph. Some of you may know me from my educational nurse Instagram, Shift Change RN. I got my accelerated bachelor's degree a couple years ago, and I actually just graduated with my master's in public health, so perfect timing with everything that's going on. I started in the cardiac ICU as a new grad, and then I moved to the Cath Lab, and from there I moved to occupational health. So occ health is what I do full time. But I go to Cath Lab every week, and that's what I'm here to talk to you guys about. So for Cath Lab, our patients are mostly cardiac. We do get more like pulmonary patients, but it's like pulmonary hypertension, so still cardiac related. We do heart attacks, transplant coordination after regarding are they rejecting? How do their numbers look? Like, is everything okay? We put patients on ECMO, Impella, balloon pump. We do temp wires. Anything that does not require opening the chest that's related to cardiac is something that we do. Something unique to Cath Lab. Other specialties do it too, but we take call. So unlike direct bedside, we don't staff overnight, holidays, or weekends to be in the hospital, but we do staff on call. So that means you're on call 1 to 2 nights a week and maybe a couple weekends over like a 6-week period. And if you get called in, you have to be at the hospital within 30 minutes. And we get called in for mostly STEMIs, sometimes like temporary pacers. If we need to lighten a load of cases on like a Monday, sometimes we'll go in like Saturday or Sunday morning and do like a left heart cath, any angiograms that need to be done. Something that I wish I knew when I started, or actually was just really helpful, was my experience in the ICU. Some of these patients are really sick, so already having the knowledge of all the intensive care meds was really helpful. Having my ACLS was great because I knew and had the confidence to give medications when something was going wrong. One thing about Cath Lab is everything's okay, and then it's really, really not okay. And if you have the basis of previous medications, procedures, devices, I took care of a lot of the devices in the unit that we put in, so that was definitely helpful. And it also helped because I could just concentrate on learning the wires, the catheters, the stents, the balloon stents, all the like nitty gritty things, and like policy and procedure. Let's see, what else? And then something I love the most would be the flexibility of the schedule. I have a great team, and if I say I'm available for 5 hours on Friday, they'll take me. Whereas the bedside, I have to work in 4-hour increments, and no one really even lets you work 4 hours, or they always ask you to stay over. Cath Lab will just take what they can get, which is so nice. And I also like just not being stuck with one patient all day. I used to really enjoy this and like follow things through, and I still do. But I like the like ever changing, like, all right, let's flip a room, next patient. And we do still get to follow people's journey with heart transplants. They come in frequently right after their transplant. So you get to see people kind of like from after they were super, super sick and just got their heart, and now they're doing well. And they just look better. Obviously they're not as sick when they get a new heart. And I really enjoy seeing that. So yeah, that's a little bit about Cath Lab. If anyone ever has any questions, feel free to reach out. I'm happy to talk about anything regarding Cath Lab, cardiac ICU, or occ health. Bye.